name is Amanda Monholland. I am the Public Information Officer for Shawnee County, and I am here today to start and welcome everybody to this grand opening of a long-awaited family planning program. You guys are going to hear from about five speakers today, and together they're going to announce the dynamics of this new program that is being offered here at the 10th Street Clinic. Our first speaker is Shawnee County Health Director Theresa Fisher. Theresa has been with the health department since 2005 and has led multiple programs over the course of her career prior to becoming the director in 2021. Theresa, you come on up. Thank you for the introduction, Amanda. Can everybody hear me okay? No. Can you hear me now? Okay, I'll be extra close here. So, good afternoon, everyone. I am excited to be standing here on this momentous day, not only for our health department, but for Shawnee County, our community. What began as a thought several years ago turned into a survey during the winter of 2018. We gave the community an opportunity to respond, and they did. We had over 300 individuals that responded to the survey. What the community told us was that if they would utilize this service if we brought it. Listen to the community and the work plan. In 2019, the plans were put into motion, but little did we know that in 2020, the pandemic would require us to put a pause on our plans and not be able to come back to them for almost 2 years. Many staff have put countless hours into the work leading up to this day. The long checklist that had to be completed, the grant applications that had to be written, the hiring and training of staff, and the list goes on. I think all would agree it was worth every minute of time put into it. I couldn't be prouder of the work that the family planning team has done. This is my chance to say thank you to each and every one of you. Your dedication to serve our community is second to none. For over 50 years, the Title X family planning services have played a critical role in ensuring to a broad range of family planning and ensuring access, to a broad range of family planning and related preventative health service for millions of low-income or uninsured individuals and others here in our nation. Today, we bring these services to our own community. Our family planning program includes a broad range of services that are related to achieving pregnancy, preventing pregnancy, and assisting all clients with achieving their desired number and spacing of children. This includes contraceptive services, preventative screenings, and health education. As the health department mission states, we are working to promote and protect the optimal health of all people by bridging gaps to eliminate health inequities. This program represents an opportunity to put those words into action. Regardless of insurance or income status, all are welcome at the family planning program. Our hope is that by opening the doors to this program, we have taken down a barrier for some in our community in order for them to be able to gain access to the services that we provide. Shawnee County has one of the highest infant mortality rates in the state, and addressing the infant mortality rate is one of the primary focuses of our local community health improvement plan. Our hope is that by providing appropriate resources and services through our family planning program, that we will be able to make a positive impact on the infant mortality rate, in part by decreasing the number of mothers who are experiencing high-risk birth. I would like to thank the Kansas Department of Health and Environment for your support and guidance to help us bring family planning to our local health department. It is a privilege to work alongside you in the effort to expand and strengthen the work we do. I would also like to thank our Board of County Commissioners for their support in this process. It has been greatly appreciated. We at the Shawnee County Health Department are delighted to open this new program. We hope that it serves its purpose for all those who walk through the door. We look forward to new partnerships and continuing to grow this program in the years to come. Thank you to all of you in attendance for helping make this day so special for our community. Our next speaker that I would like to introduce is Commissioner Kevin Cook.
How about this?
That's better.
All right. Thank you for all attending. And we're going to start by recognizing that we do have all 3 county commissioners present this morning. Commissioner Bill Rippon, Commissioner Aaron Mays. You can recognize the county commissioners. We separated ourselves off to the side. So before we begin talking about family planning in Shawnee County, I think that it would behoove us to really take a moment to appreciate all of the hard work that you, the health agency, and health workers with the Kansas Department of Health and Environment have put in during the pandemic. Not very often it's said thank you, so I just want to take a moment and say thank you. It sometimes takes a pandemic to be able to get back to what the basics are of health in Shawnee County. Family planning is one of those keystones. In the Community Health Improvement Plan, infant mortality rate was addressed as being one of a high concern for Shawnee County. Being able to get to that family planning, lots of hours spent while talking with Linda Oakes, with Dr. Locke about how do we get back to the basics of Shawnee County health? How do we address these inequities that we have within our community? How do we address family planning? And this is a good day for us to be able to get here to recognize what are the fundamentals of planning and for health in Shawnee County. But talk is only as good as the people that are doing the work. And we have some really excellent people that are here doing the work for Shawnee County. And so I just really want to take a moment and thank all of you for your hard work, your efforts so far in getting the program put together, put in place, and being able to be here today, because without your hard work laying the groundwork and the foundation, we couldn't move forward to provide those services to the Shawnee County citizens. And we do really want to support everything that you do here and recognize that you do have the full support of the Shawnee County Commission for not just all of health of Shawnee County, but in really addressing those inequities and making sure that we are doing the work that is set forth for providing those cares for the citizens of Shawnee County. So I do want to say thank you very much and pass it on to the next speaker.
Thank you, Kevin. Can you guys still hear me in the back there? I feel like it's kind of soft. No? Good? Yeah? Okay. Okay, so our next speaker is Division Manager of Clinical Services, Carrie Delph. Carrie currently oversees the immunizations, communicable disease, TB, and STI programs here at the 10th Street location. Carrie, you want to come on up?
Hope you can hear me okay. Good afternoon, and thank you again for joining us today. I'd like to start by thanking all of our health department staff, past and present, who have been working to get this program started. Many staff have been involved in the day-to-day work of getting us to this point, and many more have offered their support and encouragement along the way. I'd also like to thank our community partners, our Board of County Commissioners, and Kansas Department of Health and Environment for their support in moving this important work forward. I want to take a brief moment just to provide an overview of the various work of the health department that takes place in this building behind me. So in addition to our new family planning program, this location offers services including immunizations provided through the lifespan, as well as vaccines specific to international travel. Staff in this building conduct routine investigations for reportable diseases in our county residents, attention to clusters or outbreaks of disease. Shawnee County residents with tuberculosis infection or disease are served by basic testing, case management that can include case investigation, contact tracing, evaluation, treatment, and monitoring. This location also offers testing and treatment of sexually transmitted infections. As has been mentioned, STD services are an important piece of family planning, and we hope to incorporate many of these visits into our new program in order to provide high-quality reproductive health care. With that, I'd like to introduce our nurse practitioner, Shawnee Schmidt, for her remarks.
Years, I'm happy to be here and offering much needed services in family planning and reproductive health to men, women, and families in our community, as well as others in our surrounding community who might not have resources to access this type of care. I've been so encouraged by the many community partners, many of whom are here today, for the ribbon cutting as I reached out to see how we can better serve through collaboration. It's just so exciting, and I feel so fortunate to be on the front line providing this essential care in our community. Our motto has been from the beginning, if we build it, they will come. We're also honored to have representatives from the Kansas Department of Health and Environment joining us today, including Carrie Aiken, Jennifer Marsh, and Kelly Mark. Kelly is the director of the Bureau of Family Health, which encompasses programming across the lifespan. Her programs include early child care and youth programs like child care licensing, WIC, maternal and child health, reproductive health and family planning, home visitation, and a number of other programs that interface with Shawnee County Health Department services. Kelly, welcome, and thank you for your remarks.
Thank you, Manya. This microphone up here so my notes don't blow away. No littering. Good afternoon. Excuse me. My name is Kelly Mark. I am the director of the Bureau of Family Health at the Kansas Department of Health and Environment. The Bureau of Family Health supports public health programming across the lifespan, including reproductive wellness and family planning. We are thrilled to celebrate the opening of the Shawnee County Family Planning Program. This program will increase access to essential reproductive health and family planning services in Shawnee County and across Northeast Kansas. It has been quite a journey for this program to get to where they are. They've seen many setbacks and delays, including COVID-19, difficulties in finding a physician to oversee services, difficulty in finding a provider to deliver the services. Thanks to the great support from the Shawnee County Board of County Commissioners and also the tenacity of staff who during the midst of a pandemic worked to keep this implementation going. They really passionately believe in these services and continue to work on that implementation. We wouldn't get to where we are today if it wasn't for the great work of the staff. We are truly grateful and thankful to get to where we are today and to see the opening of this clinic. Thank you. To go ahead and get a ribbon cut. So I would like all of our county commissioners to come on up, just kind of make a line across here in front, and all of our speakers, and also Jennifer Marsh and Carrie Aiken. Come on up. On the count of three.
Let's take a photo.
All right, here we go. Everybody got photos? And 1, 2, 3.
Get it tight. Straight.
There we go.